So the Immunisation Group hit came about just trying to want to maximise immunisation across the city. Bristol having quite specific problems with a lot of mobile population, rapidly expanding population, as you've seen, a lot of children, and an old sort of database that was built around having data for the 0 to 5s, but then wanting to start immunising in secondary schools and not having any information about who was in secondary schools. Was where we sort of started from. We were asked to focus on achievement, so that's quite a good thinking ground to what sort of things have we achieved. And the main focus, the main problem area was this child health immunisation service, because, as I've said, they had out-of-date data, a difficult platform, and across the whole of England, with the reorganisation, most of the child health immunisations, child health information systems were sort of badged up with other organisations, but actually in Bristol it remained unbadged, it floated, and therefore they didn't really have a parent organisation, so it became even more vulnerable than it was otherwise, and it became a sort of a question of who would take it over. That's slightly been settled now, it's merged with Taunton, but again the data is very vulnerable at the moment because the Bristol team are trying to work out whether to relocate. So there's a lot of issues around our child health immunisation system, and it's absolutely essential to the running of services, not just in immunisation, but in lots of health services. If you look at this map of immunisation coverage for MMR at 24 months across the country, this is a sort of data that's produced all the time, centrally, really useful. What's coverage, where are the sort of weak spots, where can we focus our attention? But actually, if your child health data is wrong, your graphs are wrong, everything is wrong. And it's a complicated system in that when a child is born, they should go in, but everything that happens should be then updated. And if they leave the city, they need to come off, or it looks as if they're not immunised. If they join the city and go on, their immunisation records need to go on as well. One of the things we're trying to do, so the Bristol Health Partners gave us some of money to try and validate the data, get it up to date. NHS England and Public Health England match funded to try and help validate the data that we've got. But we're also looking at being one of the first areas to bring in Red Book, a sort of electronic Red Book system. So I don't know if you know, but when children are born, they get a Red Book that keeps all their data in it, but it gets lost. And so if you had that on an electronic system, then when the child moved, that could move with them. And we're really hoping to join with that as soon as possible. A second, I think, major achievement is just to get the right people on the bus, to try and get the right organisations around the table. And definitely on the ground, organisationally, we've done that. We have a regular meeting now of people who know what's going on, who can say, but how come you did this? That affected us in that way. We can have some quite real conversations. And I'll come on to one of those in a minute. But the third, I think, main achievement, I would say, is about public and patient involvement. We've done some workshop with teenagers in Bristol around what do they think about vaccination in schools? Would they rather their mum or dad were there? How do they feel about it? And that work was really successful, and so much so that NHS England, who work across the whole of the southwest, rolled out the same thing in Cornwall and started to ask them what they thought about immunisations. So that's been really good, and we really need to do more of that. What things are we thinking about doing over the next season? Well, immunisation with influenza has been rolled out across the country for school-age children, starting with just the year groups 2 and 3, but sort of being rolled out. And different areas chose to do it in different ways. So there's been a big push so that when you run a programme, you put it out to tender and anyone can put in a bid. So Boots put in a bid and was granted the contract in Bristol and South Gloucestershire, who achieved a 16% uptake, including the people that got immunised with GPs. It was probably more like 9% in Bristol in Boots pharmacies, whereas in schools, 55%. So while we were really disappointed and a bit cross about that as an outcome, we're going to use that data to say, actually, there is no evidence around delivery methods for immunisations. What is the effect on deprivation? If you look at the scatter plot, you can see that if you're deprived, you're much more likely to go to a pharmacy to get immunised. And in schools, actually, what happens in schools in deprived areas, this is looking at the percentage of pupils on free school meals and the uptake of vaccines. So how can we help provide some data so that this thing doesn't happen over and over again for different areas of health across the country? More and more, I think people are going to be driven to provide NHS services, previously NHS services, in private organisations, and there's not much evidence about how that works. The other thing we've been looking at is, with that data, is why weren't children immunised? So the blue across the bottom is those that were immunised, and the red just means that the consent forms weren't returned. There's a little bit of gaps in the middle from where you're sitting, yellow, which is refusal. So very few actual refusals, mostly the bits of paper weren't returned. That's a summary. And so that's something of real interest, as to whether it's just that the bit of paper got lost in the school bag, or whether parents had really thought about it and didn't want it done, and how can we change that? And how can we roll that out for things like HPV vaccination? So looking forward, we really want to press into the school immunisation, because we can see that that's definitely the most effective way of achieving a vaccine. Are there different methods of consent that we can use for parents signing up at the start of term? Yes, I'm generally happy to have an NHS vaccine in the school. What about older pupils? We've got 16-year-olds who aren't being given a meningitis vaccine because their mother hasn't signed the form on a bit of paper. That's quite ridiculous, really, in this day and age, for a young adult not to be allowed to consent for their own vaccination when they can consent for a whole range of other things. And it's so we really want to sort of press into that, do more work with schools in lessons plans, assemblies, but also in engaging teenagers to say, how do you feel about this? What things would help you understand the issues? The challenges, as ever, are this rapidly moving population, a rapidly changing immunisation schedule. Lots of immunisations are coming through all the time, and the programme changes because we generally don't put another immunisation in without taking one out. So there's always some work in progress. But for me, the biggest thing is this reorganisation of commissioning, because every time there's a reorganisation, you can't do anything. So at the moment, while there's this child health database sort of uncertainty, it means that the data gets clogged. You can't get the list of pupils who aren't immunised out, and that sort of thing really does slow things down. So, so thank you very much.
Thank you, Mary.